Hello, my name's Michael and this is my foot and ankle examination. This is Cece who's kindly offered to help today, thank you very much. Now, before I examine any joint, I like to get a full history from the patient, especially about the mechanism of injury, the type of sport that we're playing, any previous injuries and history of the pain. We don't have time for that today, so I'm just going to move on, and first thing I'd like Cece to do is if she could take her shoes off for me. Thank you very much. So looking at the shoes, I'm looking to see whether there are any insoles in the shoes, which there aren't, and also looking to see if there's any abnormal wear on the soles of the shoes, which might give a suspicion of a biomechanical problem. But there isn't any of that there just now, so we'll just leave those there. Now the next thing I want Cece to do is if you could just walk up and down for me, keep doing that just at a nice pace, and I'm going to observe Cece's gait. So I'm looking to see, is she in pain when she's walking? Has she got an antalgic gait? If so, on which side is she protecting? Looking to see if there's any evidence of a Trendelenburg gait. And then looking further down at the lower limbs, which is what we're interested in today, is there any obvious varus or valgus deformity? Is there any heel striking? Which there isn't. And that's fantastic. So we're just going to move to have a closer look of the ankles. So now I'm just going to have a closer look of Cece's ankles and feet. So ideally we want to compare and contrast both sides, but for the purpose of the day I'm just going to look at the right side. So the first thing I look at them are the malleoli. So are they visible? Is there any swelling? Is there any erythema? Is there any obvious deformity? Which there isn't. Then I like to look at the arches to see if there's any fallen arches or high arches, which there isn't. And then we move on to the toes to see if there's any toe deformity, such as a mallet or hammer toe, or if there's any hallux valgus or bunion formation, which there isn't here. And then we'd also want to have a look in between the toes to see if there are any fungal infections which can give foot pain, and also to look for rare things like melanomas in between the toes, which do happen. So next thing I'd like Cece to do is turn around for me. That's perfect. And what we're doing here first of all is doing the too many toes test. So from behind I shouldn't see more than 2 toes laterally, and it's not the case here. So that's good. And also having a look at the Achilles tendon. Now to assess this more, I'd like Cece to go up onto her toes for me. Very good. And just assessing that she can do the same on both sides and there's no abnormality when she does that. That's perfect. And if you turn around for me again, Cece. So I'd like you to just do a squat for me, and as comfortable as possible. Very good. And I was just assessing, that's fine. So I was just assessing to see if there's any abnormality of the lower leg when she goes into doing something like a squat, which was okay. And the next thing I want you to try and do is if you can stand on one leg, whatever one you like, and just bring your foot back for me.
Okay.
Good. And again, just looking to see if she's able to do that, or if there's any instability of the ankle, which is fine. Good. Okay, so we've got Cece up onto the examination table now. So I'm going to have another look at the feet just to see if there are any obvious calluses or blisters or any abnormalities in between the toes, which there isn't. So now we go on to palpation. So I have a systematic approach that I use, which starts first of all with doing a calf squeeze and just observing the patient to see if there's any pain when we do that, which there isn't. Then I move down to the Achilles and we see if there's any dip in the Achilles, any thickening, or any pain that the patient says when we're pressing on it, which there isn't. Now I go back up to the tibia, start at the top and work my way down, seeing if there's any pain, especially over the shin here, which can represent some shin splints, but there isn't in this case. And then I'll palpate the medial malleolus just to see if there's any tenderness or swelling, which there isn't. And we go posterior to that and feel the tarsal tunnel. And then down to feel the deltoid ligament as well. And again, observing the patient all the time to see if there's any tenderness there, which there isn't. Then I go back up the other side, feeling the head of the fibula, which is important especially in acute injuries. Sometimes you can get a fracture up at the top of the fibula which is missed. I'm going all the way down there again, looking for any pain. And then we feel at the lateral malleolus, again to see if there's any pain, which there isn't. And then I come across and palpate the talar dome, and across even more to palpate the navicula. Now, I've already palpated the deltoid ligament on the medial malleolus side. I'm going to palpate the ligaments on the lateral side. So the first one I'm going to do is the ATFL. Then we're going to do the CFL. And then at the back there we're going to do the PTFL. And those feel absolutely fine. And then I'm going to palpate along the perineal tendon. Again, looking for any pain on the patient, but that looks absolutely fine. Then palpating the calcaneus, and then into the insertion of the plantar fascia. And then I'll palpate the metatarsal heads. And then check the phalanges as well. So there was no palpable tenderness there, so I'm happy with that. Now we're going to do some movements of the ankle. So we're going to do some active movements first of all. So I'm going to get Cece to do these movements on her own. Again, we would compare and contrast both sides. So Cece, if you can bring your toes up towards you as much as you can, good, and push your toes away from you as much as you can, very good, and then put your foot out the way if you can, good, and then the other side, very good. I'll just hold that there, you do that again, go that way first of all, good, and out to the other side, very good. And then I'm going to hold your toes here and I want you to push your big toe away from you as much as you can and back up towards you as much as you can, very good. Now we're going to do some passive movements where I move the ankle, so you let me know if it's sore at all when we do this. So we're going to do we're going to do dorsiflexion first of all, plantar flexion, inversion, eversion. We're going to do dorsiflexion of the great toe, plantar flexion of the great toe. Brilliant. Now we're going to do some resisted movements. So I'm going to ask you to push against me and let me know if there's any pain. So pull your toes up towards you, push your toes away from you, good. Stop me pushing you that way, good. And then you put your foot out that way and stop me pushing you in, very good. Push your toe up and push your big toe down, very good. Okay, so resisted movements and movements were all normal there, so I'm happy with those. Now we'll go on to do some specific testing of the ankle. So the first thing we do would be a syndesmosis squeeze, just to see whether or not there could be a syndesmosis injury. So basically squeezing the tibia and fibula at the ankle, just to see whether that brings on any pain, and it doesn't with CC, which is very good. Next thing I do is the anterior drawer test to assess the ATFL, to see if there's an ATFL injury. So now any laxity or no fixed endpoint would be a positive finding here, but that feels absolutely normal. And then we're going to do the talar tilt test, which assesses the ATFL and the CFL. So again, I'm going to stabilise the tibia there. And there's a fixed endpoint there. Now, for that test, I would compare and contrast both sides and see whether or not there was a difference. And if there's a difference of about 5 degrees or more, then that's a positive test. But that's absolutely fine for today. So next thing I'm going to do is a calcaneal squeeze. So basically just squeezing in to see whether or not there's any evidence of a potential stress fracture, which there isn't. And then we're going to do the midfoot torsion test, which is a test for a midfoot injury such as a Lisfranc injury. So again, we're going to stabilise the calcaneus and rotate the midfoot, see if that brings on any pain, which it doesn't. Now we're going to do Mulder's test, which is a test for a Morton's neuroma. Squeezing the first metatarsal and the fifth metatarsal, and seeing if that brings on any pain or numbness or odd sensation in the toes. Now, if you feel a click when you do this test, that's Mulder's sign, which may be indicative of a fibrotic neuroma there. But there's absolutely nothing. You didn't feel any pain there at all? No, good. Now, next test that I tend to do is the Tinel's test, which is similar to what we do for carpal tunnel. So we're basically tapping over the tarsal tunnel to see if that brings on any pins and needles, numbness or odd sensations down in the lower foot, which would suggest a problem here. But again, there isn't there today. And then we'd get Cece to roll over for us, very good, and we're going to do Thompson's test. So, if you just bring your foot up like that, Cece, and relax for me, and I'm just going to squeeze gently, just to make sure that we're getting plantar flexion of the foot, which we are. And that's brilliant. And if you turn over again for me, Cece.
Yeah.
So as well as doing those specific tests, I always like to check the circulation of the feet as well. It's probably more relevant in people who have had an acute injury, elderly people with diabetes or vascular problems. First pulse I feel for is a dorsalis pedis, which is palpated on the top of the foot here. And then we have a feel for the posterior tibial pulse, which is absolutely fine. And I always do capillary refill time, which is a good assessment of circulation. Again, because we know that you can get referred pain into the foot and ankle, I always like to test the S1 dermatome especially. Now, S1 dermatome supplies the heel and the sole of the foot here, so if there's any problem coming off of the back, then we would possibly notice some numbness or sensation there. So, can you feel me touching you there, Cece?
Yeah.
Does it feel the same on both sides?
Yes.
Good.
Yeah.
Yeah, feels the same on both sides.
Mm-hmm.
So that would conclude my examination for today. If there was any positive signs there, I would investigate further, but the examination today was normal. So thank you very much, Cece.